Hi everyone and welcome to my channel. My name is Yana. If you are new here, I'm a registered nurse. I work in acute clinical area in general medicine, and in today's video is going to be just the nursing content. I just want to update you on what's happening in my life in regards of my career at the moment, because I haven't filmed many nursing videos in 2024. I was busy working and it's been a very busy year for me, building up my experience, my knowledge, trying different areas and things like that. So I have about an hour and a half before I go to work. That's why I'm wearing scrubs. Today is Friday, so it's a funky Friday, which means you can wear different colors of scrubs, including prints like a Gorman scrubs and Dangerfield. But I decided to go with I think this one is called Frosty Pink or something like that. I have shown you the try on haul of these Medi scrubs in my previous videos, so go and check it out. It's like waterproof, wrinkle-free material. It wasn't sponsored or anything at all. I purchased it with my own money because every year I try to renew my scrubs and add a couple of more pieces to the worn off scrubs. So yeah, this is my pretty pink today. Absolutely love this set, and I'm wearing this white band. So I will, before I go to work, I will put my hair into a ponytail or just like put it up somehow nice, because you're not supposed to have long hair when you work unless you work somewhere like dental assistant or an injection clinic, you know, all the cosmetics and beauty therapy, then yes. But if you work for the government in an acute clinical area, like a public area, public hospitals, you're supposed to tie up your hair. And the sponsor of today's video, I want to mention really quickly before we go into the topic of today's video, is a Linear. It's a sustainable jewelry brand, and they specialize in gold vermeil and also solid gold pieces. They also have growing lab diamonds, like this necklace that I'm wearing here in the shape of a moon crescent. It has lab growing diamonds. It's a solid gold. Everything they use is a sustainable recycled material, so they minimize the impact on our environment, which is really good as well. This necklace has 3 adjustable points. I'm wearing it on the first one, so it's like a shortest one because I like the necklace to be just in here in the middle of my clavicle bones. It's such a pretty piece. I'll show you here closer look. It's very minimalistic, small but elegant design, and as nurses we can't wear big dangly pieces of jewelry to work. Like, as you can see, my earrings are small as well, so is the necklace, because you don't want the patients to grab it, you know, so especially the confused ones. So for us it's very important for the safety of us and also patients themselves. And if you pay like you know, money for your jewelry pieces, or if you've got it as a gift, you want to cherish it. You don't want it to be damaged and ripped by someone who's confused. So it is important to wear like something that is small. But also these pieces for me as a nurse, also good to wear outside. If I'm outside of my work and I want an elegant piece of jewelry on myself, if I'm wearing like a v-neck open top or a dress, it will look so pretty together. So I'll put for you guys the name of this item and the link and a discount code in the description box below. Definitely check them out. I'm showing you so many beautiful pieces by Linear. I love to work with this brand. I cherish every single piece that I have from them, and the quality in terms of time is just amazing. The gold vermeil and also solid gold pieces, they are so good in the quality. Nothing happens to you. The quality stays the same, so as the stones. I love it. So going back to the topic of this video, so what has been currently happening in my nursing career life is that in 2023, I would say, so on my second year of being a registered nurse, all in total I have been 3 years now working in a public sector in acute clinical area. So during these 3 years, my first year was my grad year. So I was learning, I was doing the modules. So it was like a residency for doctors pretty much. You're out of your uni, but you're still learning. on practice, right? You still have your modules, you still are assessed by the facilitators and all of that. And then once that was finished on my second year and the third one, I was investing a lot into learning something that would be not included into my daily practice. So I was again going through the physiology and pathophysiology and anatomy and also medicine as well, even though like I'm not a doctor, but I was going more deeply into understanding different health conditions that I see my patients presenting with, the treatment options and all of that. So I was studying a lot on my own at home. I was going to the library, I was studying from the books and from the online resources. Also, I have subscribed to many very useful channels on YouTube as well. If you want, I can create for you guys a different video where I can suggest to you the YouTube channels that I follow, and also Instagram as well. So I was getting a lot of information from there, because Instagram is a platform where you can get a brief information in a short period of time. Like the reel can last from 60 seconds to 90 seconds. So it's like right to the point. And then on YouTube, the videos are more lengthier, but it has a lot of information points included in it. So I was sometimes grabbing my laptop, going to the cafe, grabbing my headphones. I bought this expensive headphones by Bose. It's a quiet comfort. So they have this feature where you can just cut off all the noise around you and you can just concentrate on the studies to whatever you are listening. So it doesn't matter where you sit and how busy the area is. The noise cancellation feature can help you to concentrate on your studies, which was an amazing purchase. And it was a big discount for 50% off. So from $500, it went down to a half of it, which was $250. It was great bargain. I bought mines in Meyer, and I'm using it now every single time I study. So I was taking those, my laptop, and the notebook, and going to library or to a cafe, and I was sitting down and I was studying. And for me, getting out of the house was easier and more prompting me to study rather than staying in a house, because if I'm staying in a house, my cat annoys me a lot every time I sit down to study, or even if I'm editing the videos for you, my cat just gets nuts and he starts to meow, and I feel like he's feeling jealous when I'm doing something like that. And also, like, apart from my cat, I would find so many different things in a house to do, so something will definitely distract me. So getting out of the house was like a routine. It became like a routine for me. It seems like I was going to work or to the uni again and studying. So I was investing so much into my knowledge on the duration of those 2 years and up until now. And then also what I've done, every year I would book about 5 workshops. So when you work for Queensland Health, okay, here in my state, or even in all states in Australia in general, when you work for Queensland Health, you will have access to TMS. Those are the modules that you have to mandatory do every single year. Plus, you will have a section there where they have a catalog of different trainings and workshops, and you can choose what type of training you want. Do you want to do it in person? Will be led by instructor, or do you want to do it online? Okay, where you can access the resource in the setting time frame and you can just do it in the comfort of your home. For me, I'd rather do it with the instructor, like in person, because we are sitting in a group and they allow us to interact and ask questions, which is really helpful. And to me, I would again want to get out of the house and also like see the visual person in front of me. And they use PowerPoint, they use different materials that you can touch and experience and play. Some workshops would be like hands-on in a lab as well, which was great. So I was determined to book for myself every single year in advance. In the beginning of the year, I would book like for every couple of months a new workshop, but I would book them all together and submit it for my NAM to approve, so that when they will be doing rosters for us, he would already know that she has these workshops, you know, approved for her, and it would be paid as well, which is great. Every single workshop, if it goes for 8 hours, will be paid to you as a basic rate, similar to your shift in the morning at the hospital. So it won't have any penalties to it. It will be just your basic rate, but all 8 hours would be paid. And you can book it in different hospitals. So I've booked in a hospital in the radius where I live. I also booked in a hospital's Royal Women Brisbane Hospital as well. I was okay to travel. Queensland Health doesn't pay you for your travel or for your parking there or for your meals. It only pays you just your basic rate for 8 hours of attendance. If the workshop is 4 hours, they'll pay you for 4 hours, which is great. And what I like about Queensland Health is that they support your learning. So all what you need to do is just like have a desire to book for yourself a training or a workshop and attend it. That's all. Like, it's there for you. You just need to have a desire to do it. So many nurses on my ward in my unit, we have every year we book for ourselves workshops. It depends on you how many workshops you want to book. If you want to go for 1 or 2, that's fine. I was trying to pick something that is relevant for myself. Like, for example, this year I have been already to 1, which was a wound management workshop. So I'm looking now to book in the second one, which is advanced wound management workshop. So for that you need to do the basic one first, which I've done. So now I'm looking into booking the second one. Then I'm attending in the end of this month a workshop for stroke in Royal Brisbane Women Hospital, which has been already approved and booked by me earlier. Then I'm attending, I'm just trying to think of what was the other ones. I think pulmonary workshop, and then a couple of other ones. I'll put for you the list of the workshops that I'm attending this year. I can't remember on the top of my head all of them, but they will be all spread out all the way to December. So I've been concentrating on my personal studies with the help of individual studying and also with the help of the paid workshops. Then I'm aiming now to CN positions, which is a clinical nurse position, and also CN CF position, which is clinical nurse, clinical facilitator. So it's 2 in 1. So what CNCFs do, they guide and supervise and facilitate the students who come to do their clinical placements at the hospital. So that includes your university students, which would be RNs, registered nurses, and also your enrolled nurses from TIFE. And to help me with this, I've prepped myself in advance. Last year I went to preceptor workshop. It was a 2-day workshop in person in a different hospital, and we were taught different ways how we can assess, evaluate and guide students using different methods. So it's like a teacher. It's like you are assessor, you are a teacher all in one, and how to help them, you know, to gain as much information as they can during their placement, and how to be safe, obviously. So I have finished that workshop thinking in advance that I will be applying for the CNCF positions, because for the CNCF position, they want you to have experience as well. So they would take you even if you have like 2 years of clinical acute experience, but I wanted to have a little bit extra. Okay, so now I have full 3 years and a bit of clinical acute experience as a registered nurse working for Queensland Health in a public hospital, and I started now applying for CN positions and also CF. So CN, just a clinical nurse in the different areas, and also CN CF positions. The difference is there are positions for clinical nurses that are permanent. Those ones are very hard to get, because when people get it, they try to hold on to it unless they decide to leave the hospital and go somewhere else or taking a long maternity leave. So those ones are very hard to get, but once there is a position for the permanent CN appears, everyone apply. And then there are also CN positions that are relief positions for someone who is maybe grabbing a short rural contract somewhere or traveling for a month or two or having different commitments, whatever. So they would look for a person to cover anything that's starting from a month's period of time up to 3 months and a little bit more. But it's not a permanent position, it's just a relief position for that person who is going to come back again. Okay, but they can be really a good experience point for you guys if you looking into applying in the future for a regular CN position. You have to start somewhere. You have to start to pick up these relief short contracts to know what it's like, to learn how to write your selective criteria and add it to your cover letter, how to do your resume, how to do the interview, and see if you can be successful by passing it, you know. And then once you've done all of that and you have passed it and you've been accepted, try yourself in this role, because the CN position is you are reporting to the nurse of grade 7. So CN position is a grade 6. You starting as a grade 5 registered nurse, then when you go to CN position it's a grade 6, and then when you go like NAM and director, that would be grade 7 and 8 and so on. So as a CN, you would be reporting to someone who is greater than you, like your NAM and other clinical nurses and things like that. And you will be looking at the safety on the ward, you will be looking at the things that maybe are done incorrectly, and you will be finding the resources and doing in-service training to the staff on your ward. You will be doing some visual materials like posters, you know, or some reminders somewhere in the nursing station pinned to the ward, sending emails to the staff, you know, with the correct procedure. So you will be searching for the protocols and the procedures on Queensland Health and just sharing it with others, pretty much. And you will be the point of contact if someone needs guidance, information, you know, answering questions and things like that. So that's the CN position. The CF position is when you take in the short contracts to guide the students. So when the students come to do the clinical placement, let's say for 3 weeks or for 4 weeks, you are assigned as a facilitator for them. So you're not going to be on the floor anymore. CN, clinical nurse, works on the floor. You still have your patients, you still taking the patient load, have your 8-hour shifts. But the CNCF, you're off the floor as a bedside nurse. You are still a nurse on the floor, but you're not taking load of the patients anymore. Your primary focus is to guide your group of students from day 1 to the last day, which is the end of their clinical placement, and then you will be back again on the floor, or if you want to apply for a new contract of a new group of students, you can do so. So this is what I want to do, okay? And in order to get those positions, this is why I was educating myself, self-educating myself. I was gaining and waiting to have at least 3 years of experience. And what I'm doing as well, in addition to that, next week I'm starting TL shifts, so team leading shifts. So TL is like a senior nurse on a ward who's leading the whole ward. Sometimes they would have small load, like on my ward we have load of 2 patients, and sometimes they don't have load at all, depending on the ward and how acute it is. And you are working together with the discharge nurse on discharging patients. You are collaborating with the hospital coordinator for admitting new patients to the ward, moving beds, looking at other nurses if they have like deteriorating patients. If they are too busy, you are escalating it to the team. So you're pretty much team leading all 7 nurses that are looking after 34 on my ward beds. Every ward is different. Some wards can have 20 beds, 30, 35, 40. My ward has 34 beds, so I will be looking after the whole ward. I'm doing this to add it to my portfolio, because when you're applying for CN positions, there is something you need to have, which is your portfolio. Your portfolio consists of your experience, if there is any achievements you have gained, if you have attended any workshops, any trainings, if you have any additional postgrad certificates in any other area, and things like that. So I don't have any certificates. I only have my bachelor at this stage. So what I will be adding is my 3 years of experience. I will be adding all my workshops, including the preceptorship, because this type of workshop is related to the position that I'm applying for CNCF. I will be adding my experience now, starting from next week, as a TL, as a team leader, because you need, as a CN, you will need to have these leadership skills in you. So I will be adding that to the portfolio. And if anything comes along, I will be adding that as well. If I get the job of the CNCF or just the CN, shortly relief for someone, then that would be added to my next, cover letters and CV when I will be applying for more CN positions. So this is what's been happening in my life lately. As you can see, when you start working in a clinical, in a nursing field, you never stop. Of course, there are nurses who don't want to progress and they are happy not to take more responsibility to already existing responsibility that they have, because working as a bedside nurse in an acute clinical area, like general medicine where I work, or surgical, medical surgical, is very, very hard. Same as if you would work in ED or in ICU. It's a different pace environment, but it's very demanding, very stressful, very hard on your body and on your mind. So some people prefer not to move on anywhere else, like just stay as they are, not to study anymore, not to progress to any other grades except at the grade that they have. And this is fine because you already have a lot of responsibilities and stress on you, plus working shifts as well. But I'm a type of person who likes to go for more. Okay, that's just me. I'm not encouraging everyone to be like me, because it's not easy, it's hard. But I like to challenge myself. I like to learn new things. I like to step out of my comfort zone, because when we're stepping out of our comfort zone, I think this is how we learn. Because if you always staying comfortable, you don't take the challenges, you don't explore new things. Yes, it is yes, it is comfortable and safe to stay where you are. But when you're stepping out to the new challenges and new possibilities, it may be scary in the beginning, but this is how you learn. Also, what I've been doing as well, which I have mentioned in my previous nursing videos, in the last 2 years, I think I started doing it in a year and a half since my graduation. So once I finished my grad year at the hospital, half year after that, I started picking up extra shifts in different wards. Again, why I was doing that is to step out of my comfort zone, because I was still fairly new. I was only 1 year and a half in my hospital, and I was assigned to my home ward, which was general medicine, which is a really busy ward already as it is. But I wanted to push myself into an environment that would be unfamiliar to me. I would have a new team. I would have different conditions. So I was going to respiratory ward, I was going to assessment ward, I was going to CCU ward. We have ED as well. I was going to palliative, to rehab. So all of those areas that are very, very different. And I was deliberately pushing myself to do so I could experience different situations and see how I would react, how I would behave, what skills and knowledge I would gain in those, situations during those shifts. And my goal was as well to build confidence and to work on my fear of being somewhere where I'm not familiar with the place. Because sometimes when we are overstaffed, we can be also deployed to different areas. And that would be done without asking you, because if we're short staff, you know, the hospitals still need to cover the area where they need staff, you know. So if we are overstaffed in my ward, which happened multiple times, we were deployed without asking to the areas where we were assigned to. So this can happen anyway. So I was like preparing myself, and I was just working on stepping out of my comfort zone so I could be more brave when I go to different areas, so I can be more brave as well when I talk to people, different colleagues, you know, different members of multidisciplinary team as well, different type of patients, you know, different working pace as well. So yeah, so this is what's been happening in my life currently. So I'm starting my TL shifts next week. It's going to be a morning shift. I've asked my NAM to schedule me my first supernumerary shift on a morning shift, because morning shifts are the most busiest ones. So I thought I will start with the hardest. So it's going to be me and another nurse who will be TL on that day as well, working together. So I will be taking the lead mostly because I only have one shift, and then I will be able to pick up TL shifts on my own, and yeah, go from there. So I'm very excited and I'm very scared. Fear is a part of it. I'm not gonna lie, I'm very, very scared. I'm scared for my first, you know, shadowing shift, and I will be even more scared when I will be on my own on the next one. Of course, we always have nurses to ask. We always have a certain number of CNs on the ward who are permanent CNs, and also the nurses who are not CNs. You don't have to be a CN to do TL shifts. You don't have to be a CN to team lead. We also have nurses who team lead all the time, so I know which nurses team lead, so I can go and ask them questions like, my ward is such a great place, we have beautiful, excellent team who support each other, and we're not afraid of asking questions. So of course I will always have support and I can turn to someone who can answer my questions, but I'm freaking out for the next 2 shifts that I will have. But then I know, as everything new, it's only scary in the beginning. And then once you start to do it and you do it regularly, it becomes your nature, it becomes part of your habit, and you're fine with it. Like, trust me, during 3 years, I've seen so much and experienced so much. Everything unfamiliar is scary only in the beginning. Until you do it a couple of times, it becomes normal. So yeah. So this is my life at the moment. I'm not sure yet of the studies, if I will be continuing any studies, because I was looking into masters, and I think I have mentioned this on my Instagram. I'm still looking into masters. Ideally, I would want to do the masters in nurse practitioner, in a family, maybe family nurse practitioner. But you need to have 3 years of registered nurse experience, which I have, and plus to that you need to have 2 years of clinical nurse experience in acute clinical area. In my hospital, as I said, it's really hard to get regular permanent position of CN to give you those 2 years easily, but grabbing short contracts is gonna take forever to gain those 2 years hours. So I have an option to step out for 1 year to a different hospital and apply for CN positions there, and then come back again to my hospital, work for a while, and then step out again for another year. Because by law, they can hold a place for you. My hospital can hold a place if I'm stepping out for 1 year for a contract somewhere, okay? You have to inform them that it's a contract somewhere for the purpose of that and that. And then I can go back again and step out again for a year and come back again, and then enroll into Masters of Nurse Practitioner. So this is one of the options for me in the future, because I am considering doing Masters, and there are different Masters in different areas. I'm looking into Nurse Practitioner because we are short of nurse practitioners in my state in general, and you can open your own practice, and it's a great way for the future if you don't want to be a bedside nurse forever, because it's hard on your body, on your health. So you have to think about options, what you can do in the future when you're getting older and your body is not as young. but you still want to do nursing, you still want to have a great income. So you need to think about the ways, what else you can do that will be higher than what you're doing now. So I'm still looking into masters, so I have to work for that, obviously. And I'm also looking into, if it's not masters in nurse practitioner, sometimes we have offers by Queensland Health, masters in different areas, still nursing, that they would cover 75% and then you pay from your pocket another 25. You can take hacks on that if you want to. All of this is legitimate in the universities that are supported by MBA and APRA and all of that. But they would be like whatever comes in offer. Like last year we had masters in research. I wasn't really like interested in research, so I didn't take it, but 75% was covered. One of the girls on my ward took it and she was happy, and then she applied for the research position contract for 6 months as well, and she was doing cardiac research, so she was happy with her decision. So I'm waiting, maybe something will come up again, maybe in a different area. But what I like about it is that 75% is paid by Queensland Health. If you decide to pay 25% from your pocket as you go, then you can claim it in tax, which is great. You just need to make sure to have it in your pocket. If you take hacks, you can't claim it through tax. You have to pay through hacks fund, and it will be just deducted from you every year when you do your tax return. So yeah, this is what I'm thinking for the future. So far I want to stay in a clinical acute area and learn as much as I can while my body and my health and my age permits me to do so. The older I become, the more possibilities I will look into stepping out from the bedside nursing, as I said, doing masters, for NP, maybe doing something else, maybe doing some postgraduate certificates. If it's not masters, maybe stepping out and doing maybe short rural contracts, traveling, within Queensland Health, and earning more money. It's still bedside nursing, but you will have really, really good income, because rural nursing can reach up to 300,000 a year if you pick up short contracts throughout the year. Yes, you will lose the privilege of the bonuses and rec leave and sick leaves and all of that. You will be managing your short contracts by yourself, but the pay that they pay you is really good. And if you want to see like Australia, if you live in Australia, that's a great way to see the states and what's between the states as well. So I have people on my ward who do that, and they were able to buy houses just from 1 year during the short contract, because the pay is so great, and you have allowances like the food allowance, your petrol and all of that. So it's really great. So that's another possibility for me in the future as well, if I really want to do that. But in terms of stability, something stable, would be better than doing rural, because as well you can't do it on a long run, because doing short contracts, traveling all the time, you can do it a year or two, then you need to have a break, because it's still exhausting as well. But yeah, so these are my thoughts. This is what I'm doing now in my life. I thought I will update you guys, so you can have a bit of a glance what's happening to nurses, past nursing students once they start to work and pass the grad, what possibilities are there, and what we're thinking, what we're prepping ourselves for. So I thought I will share it with you guys on my channel. If you have any questions, leave them in the comments below. If you want to share your stories, your experience, what you do in post-grad, what's your plans, share it as well. I'm curious to know. I read all your messages, guys, all your comments. Till then, thank you for staying with me on my channel. Please subscribe to my channel, because that helps to suggest my channel to wider audience, which I will greatly appreciate from you guys. Please subscribe and like this video if you do, and I will see you in my next videos. Bye.